bursitis, that is swelling on the elbow. So sometimes it happens that you've had an injury or a trauma, that is, you've hit your elbow, the point of your elbow here, you've had a hit here, or you have the habit of sitting with your elbows on your desk like this, or there is a lot of stresses on your elbow joint, and this can lead to a swelling right on the tip of your elbow here. So basically around this part here, we are not talking about golfer's elbow or tennis elbow, which is more pain on the sides of the elbow. So if you have this sort of a swelling, it could be that you have olecranon bursitis. Now, I will explain those two terms very shortly, very soon. But before I go into this, let me just introduce myself for those who do not know me. My name is Swati. I'm an executive mom power coach, and I help moms who work, well, moms of younger children who work in high stress executive jobs, and these moms are so busy at work, at home, that they do not have time to manage their physical aches and pains and discomforts that originate probably with their pregnancy, probably from childbirth, or later years as they're running after their kids and taking care of home and work, etc. Now, this could range from neck pain to back pain, heel pain, to maybe a poor posture or a weak pelvic floor. So, I give you simple strategies and easy tips to manage these, as I know you don't have time, you're busy. So, I just simplify these and break it down for you so you're able to manage these aches and pains without them interfering in your professional or personal life. All right, so going back to Olecranon bursitis. So basically, the name Olecranon bursitis is because this bone here is known as the olecranon, and bursitis is inflammation of the bursa. Now, bursa are like fluid-filled sac. Now, they are present in areas where our bone is in, could be in direct contact, and especially in an area like, as I said, the elbow here, or when you're kneeling down on your knees. So areas where you can have direct friction or pressure, so that your bone doesn't get that direct pressure or friction. There is like a fluid filled sac here between your bone and your skin. This is a bursa, so it's like a balloon like structure. You can say a water filled balloon that is present there. So it's just nature's way of saving our bones, really. So when there is an inflammation in that bursa, this is known as bursitis. So anything with the itis, itis at the end, means an inflammation. So olecranon bursitis is when you get swelling in this area because your bursa is inflamed and it's, well, I mean, there's fluid and inflammation. I mean, inflammation happening, so there's a swelling there. So if you do have this swelling and you're wondering if it is olecranon bursitis, so I will talk to you about three signs that can potentially indicate that you have olecranon bursitis. That is, the swelling on the elbow is because of your bursitis. So the very first sign is obviously that you have a swelling there. Now, what happens is, as I said, this bursitis can happen because you've had a lot of friction on your elbow. Like if you're one of those, say you're reading a book or a newspaper, or, well, holding your iPad and you're holding it like this, and there's a lot of friction on the point of your elbow against the table, or you are in a job where you're kneeling down a lot and you are like sort of supporting your body weight over your elbow, or you've just had a trauma or a direct hit onto your elbow. So it is possible that you get this sort of a swelling. It can also be that you've had a cut, or uh, a your skin has basically broken down over here because of whatever trauma or cut, and because of that you've got an infection inside your bursa. So the very first thing is you will have swelling there, so it will increase it, the bursa size will increase, and you will see that there is like a pulpy sort of a swelling. So when you press down on it, it doesn't feel like a bone. It feels like there is some, you're pressing on a water balloon, right? So that is the sort of swelling that you would expect. There will most probably be a redness in that area because that's one of the signs of inflammation, and it'll be painful to touch. Okay, so that is the second sign. It is quite painful to touch, and the third sign is that there will be a lot of redness in the area. So when you say redness, you don't expect like a stark red color, but if you say you stand in front of the mirror and you compare the two elbows here, you will see that the color on the affected side is slightly darker, slightly more reddish. Okay, another thing, another feature for that can tell you that it is olecranon bursitis is usually when you extend out your arm like this, it'll not be so painful. But when you bend your elbow, there will be pressure over the bursa, and that will be quite painful. So anytime that you bend your elbow and you feel a pain around this area which is red, painful, swollen, you can suspect that you have olecranon bursitis. Now, what is the reason for me telling you these three signs is if you have this problem and you suspect you have olecranon bursitis, go to the doctor and discuss it with your doctor, your healthcare professional, and then they can take it on from there. Usually, a doctor will be able to diagnose these bursitis by just looking at, by looking at and doing physical examination of the elbow. However, sometimes they will also, if there is like they suspect there's some sort of an infection, they might send a sample from inside the bursa, so the fluid in the bursa for lab tests, or they can also do ultrasounds, but that depends on your doctor. Alrighty, I hope that was useful. And if you are suffering from olecranon bursitis, it is a very painful condition, so go and have it checked out. Alrighty, I'll see you guys next time.